Picture this. A single drop of blood contains approximately 5 million red blood cells, each tasked with the crucial role of transporting oxygen to our body tissues. Now imagine when these diligent cells are not enough in number or lack the necessary protein hemoglobin to perform their duty. This scenario is not a mere product of imagination for around 1/4 of the global population. It's the stark reality known as anemia. Iron deficiency anemia, the most common type, originates from an insufficient intake of iron. This key component for hemoglobin production may be lacking due to poor dietary habits, blood loss, be it through menstruation or gastrointestinal bleeding, or an inability to absorb iron. Then we have vitamin deficiency anemias. A case in point is vitamin B12 deficiency anemia, stemming from a lack of vitamin B12, which is essential for red blood cell production. This can result from dietary insufficiency, malabsorption, or certain medical conditions affecting B12 absorption. Folate deficiency. Anemia, on the other hand, arises from inadequate intake of folic acid, otherwise known as vitamin B9. This type of anemia is commonly associated with a poor diet, alcoholism, malabsorption, or the use of certain medications. Hemolytic anemias are a different breed resulting from an accelerated destruction of red blood cells. This can be either inherited or acquired and often results from factors such as autoimmune disorders, infections, or certain medications. Aplastic anemia is yet another type where the bone marrow dysfunction leads to a reduced production of red blood cells. This can often be idiopathic, but exposure to toxins, certain medications, or viral infections can also be the culprits. Sickle cell anemia and thalassemia both result from inherited genetic mutations. In the former, the mutation affects the hemoglobin structure, causing red blood cells to become rigid and crescent-shaped. This leads to blockages in blood vessels, pain, and organ damage. In the latter, the mutation affects hemoglobin production, resulting in fewer and abnormal red blood cells. Lastly, chronic disease anemia is secondary to underlying health conditions such as inflammatory disorders or chronic kidney disease affecting red blood cell production or lifespan. Each type of anemia has its unique features and causes, and understanding these specifics is essential for determining the appropriate treatment. This could range from dietary changes and supplements to medications or, in severe cases, blood transfusions. Diagnosis and management should be done promptly and appropriately. Prognosis can worsen if management is delayed or neglected. After all, our bodies are a complex, finely tuned machine, and every component, including those diligent red blood cells, plays a vital role in keeping us up and running.